healthcare systems across the world. Let's talk about it. In this, we're going to compare the United States with Italy and their healthcare system. We're going to go over the pros and the cons. We're going to compare the two. What's better? What works for them? What works for us? What doesn't work? Let's talk about the United States first. As we are all familiar, the United States healthcare system is complex. It's confusing. It's expensive. Most of us can't afford it. As we know, America has a blended program pretty much for healthcare. You can privately pay for your healthcare. You can maybe do a government-funded program such as Medicare, Medicaid, if you qualify. Or what we see often with people who work are our employers contribute a certain amount to our insurance that we pay a monthly premium for. So let's dive into that a little bit more. So if you qualify for Medicare, depending on your age, depending on if you have a disability, your socioeconomic class, it all varies on that. Whether you're pregnant, if you have, disabled children, everything you have to meet a criteria for that. So if you do, a good chunk of things are covered. They are, but it's government funding is where it comes from. Then we have the private insurance, which is what it sounds like. It is private. You're paying for it. You're paying a monthly premium. You're paying for your services. What you want is what you want. It's what you can get. Extremely expensive, though, because you're paying for everything. Then we have, say you're working. They offer certain plans through your insurance. Well, they'll pay 70% of the plan. You pay 30% of the plan. So your monthly cost is probably $200. But you also have a deductible. It might be $6,000 that you have to meet before you can get everything done in 1 year. But that's not it. You could choose between an HMO, PPO. It depends on what your company offers. Do you know what those are? Most people don't. So, if you want an HMO or PPO, you might have a lower deductible for one. You might have a higher deductible for the other. But you're going to have restrictions on that. The less you pay, the more restrictions that you have. Thankfully in America, if you do have an emergency, you can go to the hospital and get care. It's going to cost you, though. You're going to have a bill. And if you do have insurance and you're capable of telling them that you do have insurance and you're not literally dying walking into the door, they're going to run that insurance first. They're also going to ask you for your deductible money first. Then you can get some services. Now let's switch gears. Let's go to Italy. Italy is a universal healthcare system. Pretty much if you need it, you're going to get it. And it's not going to cost you a thing. Yeah, they probably have some higher taxes. We're taxed on everything too. Okay. They might have some out-of-pocket costs for maybe specific prescriptions, but for the most part, everything is covered, minus those taxes. Just like America, their over-the-counter medications they do have to pay for. I went to Italy many, many years ago, and I had a migraine. I could not get rid of this migraine. I was there for 3 weeks. It was beautiful, great. So I finally went down to the local pharmacy, who has a doctor in there. The doctor asked me what my symptoms were, and he gave me a pill. He said, here's a pill that should last you 8 hours. If your symptoms are not gone after 8 hours, you can come back and see me, and I will reassess you. Granted, it took me 2 hours to talk to this doctor and get my 8-hour pill. But I did, and I was fine after that. I didn't need anything else. So when we look at Italy, yes, it's free. Not always convenient. And depending on the region that you're in, they don't have all the resources and facilities and urgent cares and all these buildings on every corner of the street. So there is longer wait times. There is more transportation problems. You might have to go 50 miles, 100 miles down the road just to see somebody. And you're going to be waiting a while because they're so far stretched out, covering large areas of the land. And that means more people. So that might be a little bit of a downfall for Italy. But If you know, here in America, there's a wait time, a wait list for everything here too. But we're paying the price as well. Which one's better? Then we look into how easy is it? Why is America so difficult? Why is it so complex? Why? If we have all of these government-funded programs that's covering a good chunk of the population, at least 30%, why are we still having all these high-cost medications, these hospital visits, these doctor's visits? Why are we having it? We have advanced technology. We have wonderful universities for education. We have it all. We also have big bills. Why? Is it part of the American healthcare system? We have to pay for it. It has to be overly expensive. Is that the program we're doing? It is causing some issues. People aren't going to the doctors. They can't afford the healthcare coverage. They don't qualify for the government funding. So now we have more problems in the medical field. People are waiting, not going to the doctors, regular routine things. If something's going on with their body, they don't see somebody, they don't say anything because they can't afford it. Then 2 years down the road, they end up at the ER and need a major surgery that costs the hospital and everybody hundreds of thousands of dollars. That could have been prevented with universal health care coverage. So yes, we know that America needs to figure out what's going on with healthcare because it's not the best. It's not the best. And we say we're a leading country, but America needs some help. Just like Italy, a lot of European, some countries have higher taxes to help offset the medical cost, and there would be uproar in America if we had to pay higher taxes, especially if we're healthy. For unhealthy people, but think about how much it would really save you. I don't know about you, but I have turned away from going to the doctor because I know that I cannot afford it. Not to mention, how many times have you not gotten medication because you couldn't afford it? I have. I've had to make the decision between paying my car payment and paying my son's asthma medication. That shouldn't be happening in America. I work 50 hours a week. I go to school full time. Why am I having to decide on life-saving medication for my child? Because it's overly expensive. Why is it overly expensive? Can you guys answer that question? The American healthcare system has gone too far. To compare between America and Italy, which way is better? Is there a way for America to turn into a universal health plan? It would take some time. It really would. But there are way more benefits to that than what we are doing now.